As of 9 June 2020, the cumulative world case count of COVID has recorded over 7.2 million people infected, and just over 410,000 have lost their lives, thus giving a fatality rate of 6%. I have borrowed the economic impact of COVID slide from International Monetary Fund. The slide shows IMF estimates in April 2020 of real GDP of major countries between 2019 and 2020 to show the effect of COVID pandemic. Now, the first country that it shows is United States of America, with its GDP in 2019 at 2.3, which is likely to fall to minus 5.9 in 2020, thereby giving a GDP fall to the level of 1/4. The next one is the European Union collectively will lose the GDP to 1/7 by the end of 2020. Japan will lose to 1/8, China to lose to 1/5 of its earlier GDP, while Indian GDP in 2019 was 4.2% and would likely drop to 1.9% by end of 2020, thereby effectively reducing the GDP to 1/2. This is despite the fact that India chose to go for a national lockdown to save as many lives as possible, even at the cost of economic losses that were anticipated due to these lockdowns and shutdowns. A country like Russia is likely to reduce its real GDP by end of 2020 to 1/5 of 2019. Similarly, Brazil to 1/6, Saudi Arabia to 1/9, and South Africa would go down to lose to 1/5 to 1/25 of its GDP as compared to 2019. So, with all this background, it is important for us to now look at the economic impact and hear what is happening in the economies of several countries in Asia and Africa. And we have the next speaker, Mr. Karan Bhasin, who is an economist and policy researcher and also director of Global Young Action Network Foundation, India. So it is up to you.
Thank you so much, sir, and thanks to Sambodhi, ISRN, and University of Washington for taking this initiative. Uh, so one of the key issues that I want to begin with is exactly what is it that we are dealing with right now? Because there's a lot of focus on the impact on GDP, impact on livelihoods, impact on income, etc. But it's also important to recognize what is it that exactly is the nature of the problem. Uh, so the slide that you shared was estimates that were during the World Economic Outlook, when IMF came out with it, and a lot has changed since then because just yesterday World Bank came and said that this is going to be the worst global recession compared to the World War II, and I think within the last month, a lot of unknowns have become known, but there is still a lot of uncertainty regarding what is likely to follow. And what happens in such an uncertain period is it is very difficult to accurately predict what is going on. Uh, so the best that we can do is to sort of put in place an analytical framework to understand what exactly is happening. Now, this pandemic has two dimensions to it. One is the public health dimension, and the other is, of course, the economic dimension to it. I would actually like to share my screen to give a sense of idea, of exactly what is it that uh, represents this trade-off. So this is basically a scatter plot that shows number of government social distancing measures and the number of cases. And what this makes very clear is that the more social distancing measures that have been taken by countries, the number of cases on an average has been lower, which means that, of course, social distancing has worked. And what it also means is that when you impose social distancing measures such as not allowing more than say 10 people to be in a crowded space, etc., it has an impact on contact services. And contact services basically means your restaurant, hospitality, and industries such as that. Uh, so of course, this pandemic is going to have a disproportionate effect on certain sectors of the global economy, such as aviation, as we are now seeing. Whereas relatively safer sectors could be, agriculture, etc. And that is true even for India, because we see that agricultural sector has not been very adversely affected. Uh, so this trade-off is something that we need to keep in mind, that if you want to save lives, then we need to put in place social distancing measures, and they obviously come with a certain degree of cost. Uh, Now the next thing that I want to talk about is China, because this entire crisis originated from Wuhan, and China was one of the first countries to go for a lockdown, and obviously it sort of did face certain costs associated to it. So when we look at China, we see a very swift V-shaped recovery in economic activity, which is very encouraging, because a lot of the focus that all of us have had over the last couple of months is to basically put exactly the growth trajectory, that what is going to happen once the lockdown is lifted across countries, what is going to happen when the fear of the pandemic is going to subside, because we don't see a vaccine coming in till sometime next year, and that means that this virus is something that we have to stay with for a while longer, and we obviously cannot keep our economy shut. Uh, so this graph basically presents exactly what kind of recovery we are looking at. It is going to be a very swift recovery, and this data is also sort of corroborated by the China PMI numbers and US initial claims data, which basically represents the joblessness. A key point about this statistic is that in history of this data set, US never experienced such a sharp increase ever, as it did in the pandemic, and that represents the scale of the economic disruption that this has caused. Uh, and now that the situation is also drastically improving, it again signals a very swift recovery. But this scale of disruption is important for emerging market economies such as India, Brazil, Argentina, and of course, even some Asian and African economies. One of the key things that we need to recognize is that the world is not fair, and the way the economic system is, obviously, so there are certain privileges that the early industrialized countries have that are not available to the global south. Say for instance, countries like US, UK have gone ahead and given record high stimulus packages to absorb any form of economic shock from their companies. Now that's a privilege that economies like say Argentina, etc., cannot afford, because the moment they start doing that, there are concerns, and I'll come into those concerns in a bit, because they're very relevant for countries like India and certain African countries as well. So that differentiating factor is something that we need to keep in mind. But before that, I want to talk about lockdown, because there's this entire debate happening that, and this is very true for the Indian context, where people are saying that there's no demand, and that you need to give a demand-driven stimulus, you need to do cash transfers, etc. Some of which government has already done as a part of the 20 trillion package. Uh, but this is what I want to discuss. Lockdown means that there is no economic activity happening, and that essentially means that there is no market operating. And when there's no market, you don't know whether there's demand or supply. So we cannot make any prediction about whether there's demand which is missing or not, unless and until obviously we lift the lockdown. And of course, lifting the lockdown means taking a risk in terms of increased cases. So that's the trade-off that government face. Uh, but of course, every day of lockdown has a cost associated with it, and we should be well aware of these facts, because at some point people are going to ask that why is it that your economy hasn't done well, or why is it that your GDP has contracted, because as of today India is also likely to register negative growth. And of course we'll register negative growth, but it won't be as bad as some of the other countries, so we'll still be relatively much better off. But the reason why we'll get a negative growth is because now it's been over a particular, over an entire financial quarter, where there hasn't been economic activity in nearly 60% of your economy. And when that happens, you obviously cannot expect any form of growth to happen. So that's something that we do need to keep in mind.
Before I would start, I would particularly like to thank Sambodh Research Foundation to invite me to talk about this very important issue. And I would particularly like to thank Professor Subhash Hira. We are talking about a very important issue and quite dear to me. I've been a practicing psychiatrist here in Canada, but have worked in many different countries, including many different parts of Africa, Asia, in Europe, and Australia, New Zealand. And before we go any further, I think it's not all doom and gloom. It is important to realize that most of the people are actually quite resilient and will not succumb to psychopathology. I believe that some people actually will find new strength and even experience some sense of relief. I have my patients actually telling me that enough of running around and they would like to re-examine their lives. And I believe that society at large actually may also experience significant compassion or will come up with a lot of innovation. Look at this meeting today. We would not have been able to do anything like this before the pandemic. Because there is an urgency, a lot of new innovation is occurring. If you look at issues like climate change, people are becoming more hopeful now. There was a newspaper headline which says that the office is dead. I don't know whether that is true or not, but there people have realized that there is no need to continue to work in an office setting because majority of the work can be done at home, and we might see actually less cars on the road. The in terms of lockdown effect per se, in many countries, the lockdown came very suddenly. So at that time, before the lockdown came in, I think people did notice, especially there were some newspapers which were making some headlines. There were some medical journals, they were printing some articles about what was happening in Wuhan, China. Before the actual lockdown came in, although there was some kind of rumblings, I know that there was a denial not only at an individual level, but even at an institutional level. I remember that I was talking to a couple of my colleagues, and in fact, they were thinking that this is just going to be a glorified flu because we had all gone through, especially in Canada, we had gone through that scare during the first SARS episode in 2003. And then the H1N1 flu came in. And at that time, somehow there was a magic bullet found. But unfortunately, this kind of denial did not serve the purpose in many countries. So what happened was that when the lockdown did occur, the reaction was similar to kind of a grief reaction, whereby there was complete shock and denial. People were becoming angry, and then slowly a bargaining kept in that no, they'll be okay. We'll be locked down only for a period of time, and everything will be okay afterwards. And when they realized that no, that was not going to happen, then slowly the despair and fear started to creep in. During the mid phase of the lockdown in many countries, slowly but surely there was a lukewarm acceptance. The acceptance was not complete acceptance, but people are thinking that, well, what choices do we have? Because we are all in the same boat, or we are all in the same storm, so to speak. But underlying the kind of resentment was kicking in. Now, people have started seeing the late effects of the lockdown, whereby we have seen hopelessness. There's some kind of lockdown fatigue that is happening, whereby people were saying that this is enough. And some people would start to break rules or regulations whereby they were not observing the social distance. And this is the period of the time whereby there has been observation of frank psychotic behavior or manic behaviors. People have become violent, and there is a more risk of substance abuse, especially people using more and more nicotine, alcohol, and other drugs. The unfortunate part of the lockdown is that there is a destruction of social fabric. whereby there is an inability for a group of people to attend important, significant events in their life, be it birthday parties, marriages, or even funerals. And that led to a lot of different behaviors by different group of people. And unfortunately, that also led to stigmatizing certain group of individuals. Sometimes we heard the reports of certain healthcare professionals being stigmatized. We know that there's some elderly population that is being stigmatized. In Western countries, there are Asian people who are being stigmatized. And unfortunately, the social media, the conspiracy theories, and the so-called paid pundits did not help the situation.